24 hours. So somebody has severe pain. So you have got a oromandibular dystonia in dentistry. So what do you know about oromandibular dystonia? You all dentists, right?
Yes.
So what is oromandibular dystonia? Give me
TMJ is different.
TMJ is one point. My question is 2 lines for a layman to understand. Whether it's a jaw opening dystonia, it's a jaw closing dystonia. आपको खोलने में तकलीफ होती है मुंह, फिर बंद करने में तकलीफ. There are different muscles for it. So if you have a closing problem, then it is masseter and temporal. If it's an opening problem, then it is digastric and medial pterygoid. Am I correct? Am I correct? Today you go back, open the TMJ joint. What muscles I told you, check, mark it. Next time when you do a workshop, keep a jaw opening, jaw closing, keep a tongue dystonia. Okay. So as a dentist, you will get more TMJ patients. So that's why I keep it. Coming back to the approved indications of botulinum toxin, one is glabellar frown lines, 2 muscles involved, processus in the center, corrugator on 2 sides. So what are the parts of the corrugator?
Head and tail.
Head, body and tail.
Head body.
So this is a very line. You should not inject in this line, so you avoid the tail. So you have to hit the head and body. So suppose I take this process, so you have to pinch it like this. And corrugator, you have to hold it like this. So only head and body. We only hit the head, we don't hit the body also. There are 2 ways of doing it. Either you do 4 points, 4 points, 4 points, 4 points, 4 points. That means process is 4 points, head of the corrugator 4, body of the corrugator 4. But sometimes we avoid the body also. And we do 5, 5, 5. So rather than being 20, I do 5, 5, 5, 50. So other approved indication is forehead line. So you draw 2 lines from the mid-pupillary line and you inject in between that. Okay. Hit 2 inches above the corrugator, not below that. And make 2 rows of 1, 1, 1, maximum 10 points, but you should take 5 and 5 is 10. The other way of doing forehead lines is 2 inches above the corrugator, hit 1 shot of 5 units. It will disperse. So the bruising is less. 5 units, 1 shot. So there are 2 ways of doing it. Either you do 1 unit or you do a single shot of 5. Depends on the patient. If skin type is 1, 2, 3 and very thin skin. If she says my skin is very prone to scars and keloids, then give 1 shot.
5 ml, 5 unit bolus.
1, 2, just 1 shot. It spreads to 1 to 2 centimeters. But if the patient has keloid formation tendency or scar formation, don't give too many shots. She might develop more keloids. To keep away from such things. Second important thing is, third indication is crow's feet. It is also known as outer canthal lines. So 2 centimeters away from the outer canthals, you have to inject 1, 2, 3 like this. Okay. So the idea is maximum is 4, 4, 4. But always reduce from below. If it is mild, you will do 4, 3, 3. You will do 4, 2, 2. You will do 4, 3, 1, 4, 2, 1. Last we will reduce the top one. 3, 1, 1, 3, 2, 1, 3, 3, 2. Depends. There is no wrinkle assessment scale. So I would request all of you to go to the net and check what is the wrinkle assessment scale. So grade 0 to grade 5. From dynamic to static. So whether it is just when I do like this, I get a light, this is dynamic. That should be. So I don't want this light, I will not. But if I, without doing this, if I have lights till here, then they are static. So you inject a very high dose. So 4, 4, 4 is the maximum. Always the dose in a female is 2/3 of the male. Suppose you are injecting 12 units in the male. The female you should inject 9 or 8. And always underdosing. Lower the dose, safer it is for you. There is known as postural hypotension in dentistry. You must have seen patients when you work with expansion. Patient might get vasovagal. What will you do? So the same thing happens here also. Don't try to inject too much so that you have side effects. Most importantly, these are the 3 indications. One is the glabellar frown lines, processus and corrugator, forehead lines. That is the frontalis muscle. So it is not a frontalis muscle. It is a big muscle. It is the occipital frontalis. It's a single muscle. So sometimes you inject for the eyebrow and the eyebrow goes very high. How do you get it out?
Then we inject in frontalis.
You inject the origin, occipitofrontalis. You see the occiput on both sides you inject, the eyebrows will come down. Everybody injects here. You should inject here.
Yeah.
People don't know how to get the eyebrows down. So this is another issue that is used. Most importantly are the off-label treatment. You want to learn about gummy
How
spine?
many units, sir?
5.
10.
Depends upon how much you want. It can be 2 also if you want slightly. Or maybe only one side has gone up, one has gone down. So here this side you put 5, so it will become equal.
Okay.
So next time when you have such patients whom
And
you
sir,
are
just one
injected,
question. I have that
Masseter.
masseter hypertrophy, no? That time, like, I felt
we will
myself.
do it for you.
Yes, that's what, sir. That's my face, like, it was better, slightly downwards from here and upwards from here. And there was not. I have
this
to
side
wait
of the
for.
face went down.
Yes,
You
yes.
know why?
Yes, tell me, sir.
Why? So the muscles of the face. So when I say that 26 muscles of the face, whether they are elevators or they are depressors. Some muscles elevate the face, some muscles depress the face. Like occipitofrontalis elevates the forehead. Depressor anguli oris depresses the face. So when you inject, it elevates. And here if you inject, it depresses. So my question is, why this happened in the masseter was, if you see the maxilla and the malar area here. So there is a muscle on the highest point of the malar bone, zygomaticus minor. This you inject in dentistry for dyskinesia, flickering. Sometimes you see the face twitching. That's known as dyskinesia. Second thing. Next to that is the zygomaticus major. Do you know that?
Yes.
So what she has done is, when you inject the masseter, if you are too superficial, and if you are near the zygomaticus major, the main side effect of injecting the zygomaticus major is drop jaw. So what she saw was a drop jaw on one side because it spread into the zygomaticus major. That you should not allow to happen. So that also I will show you today how to avoid. So what happened to your patient on one side was a drop jaw.
It was me only,
So
sir.
it was a drop jaw. Who did drop jaw?
Some doctor, some very professional doctor did it.
So thanks to the doctor to give you a drop jaw for 4 weeks. How much time was it on?
Yes, sir. 4 to
4
5
weeks.
weeks. 4 to 5.
4 weeks.
Okay, 4 weeks.
Same way as a ptosis. Ptosis is at least 4 weeks your eye will remain closed because they are editing the ventricular line. So you should know. If
Because,
you-
but she don't have the solution how to correct it.
I have a solution.
Yes, but she looked at that.
Inject the DOI high dose, the depressor anguli oris. So it will elevate. So it will help you at some stage. So the thing is, when you inject the masseter, they try to inject 2 or 3 heads, right? How many shots?
Yes.
3?
3 to 4, I
I tell
think.
you. You only inject 2 out of 3 heads. If you inject all 3 heads, your face will drop. So there are 3 heads of the masseter. You have to inject any 2.
How many units, sir? 8.
So you start with 5.5 in females and 7.5 in males. That is 15. Then you can give 10-10, then you can give 10-10 in 2 heads in females. But if she is a vegetarian, if she is a non-vegetarian, then reduce the dose. So she have a cheap drop. So for first thing, so you have to ask, you are vegetarian or non-vegetarian? Vegetarian, okay, don't have chapati for 2 weeks, have a soft diet and rice, we'll try to slim your face. So this is one way of doing it. Coming back to the toxin, it's a 900 kilodalton complex. I think you all know. 750 kilodalton is the complexing proteins, which are known as heme, glutenins and non. They stabilize the molecule at 2 to 8 degrees for 36 months. The USP of this molecule Stunnox is, suppose the light goes away here for 4 hours. So there is a stability test we have done. It says that you can maintain this molecule at 25 degrees for 6 months. अगर आपकी 4 घंटा लाइट चली भी गई है तो उसको प्रॉब्लम नहीं आएगी. तो इलेक्ट्रिसिटी फ्लक्चुएशन के लिए भी हमने ट्रायल और स्टेबिलिटी डेटा कर लिया है. Most importantly, being a 900 kilodalton complex, it has a heavy chain of 100 kilodalton, light chain of 50 kilodalton, and complexing protein 750 kilodalton, which stabilizes the molecule. The main job of the complexing proteins is to stabilize the molecule so that they get efficacy to you for 12 to 16 weeks. That is at least 4 months. That is the whole idea.
We can check the efficacy only after opening the bottle.
How?
I'm asking this thing. How can
Efficacy is only after injecting and the
injecting
feedback
whether
from the
it's
patient.
working now? Okay. Because the electricity fluctuation is the issue. At times,
Electricity
like different-
transition, we did the trial. In fact, I would see how I can accommodate you all in our manufacturing unit, how it is manufactured. You all should see it once actually. Because the best doctors in the world have never been allowed in the manufacturing unit to see how it is manufactured. We can show you all how it is manufactured. You can meet the R&D guy, how it is made. You know, what are the side effects, what are the no-go zones of the molecule. Now, what I will do is giving you a brief. If you have any questions, you can ask me.
So we have to apply numbing cream
Yeah.
before.
Have you applied numbing cream? This is the changes in melanin pigment also. If you see in patients when you do the filler, you have ever tried the fillers? Hydration fillers,
Yes.
folate. So
Skin
for
booster.
pigment issue, yes, skin booster.
Yes.
Profilo? Profilo.
They're still in beta.
Huh? My teacher from Australia, Niam Kadu. So you should know basically the frontal bone, the temporal bone, the occipital bone, and the temporalis bone. Why? You should know the surface anatomy for injection. You should know from where the blood vessels go, from where the nerve supply goes. Because you will avoid, you should know the foramens, infraorbital foramen, supraorbital foramen, ventral foramen. So you should keep away from these areas. The area of the face, you have to be careful while injecting in a nasal level fold with the filler because of emissary waves that go in the cavernous sinus of the brain and can cause TI and stroke. So you have to understand that if you know a bit of anatomy about the bones, there are 26 muscles on the face. What I told you about procerus and corrugator, frontalis, masseter muscle, then orbicularis oculi muscle for the eye. Then this is the zygomaticus minor, zygomaticus major. This is the orbicularis oris muscle. This is the mentalis, depressor angula oris basically. Levator labiosucus alec-nasal, very important muscle here. A nasal strip also here. Depressor septa here for gummy smile. For gummy smile, you have to inject here and here to get the lip down. So there is one depressor supercilii here inside here. If you inject that, the eyes pop out a little bit because with age there is resorption of the bone and your eyes get deep seated. So you want them to just be a little out when you relax the depressor supercilii. So you look more fresh. So muscles are many, you have to learn. Arterial supply, you should know which artery goes from where. Whether the internal carotid or the external carotid. There is only 2 arteries which supply the whole face and neck. Nerve supply is when you get the pain, it's a trigeminal nerve. That's the 5th cranial nerve. And if you get numbness after injection, that is the facial nerve, that's the 7th cranial nerve out of 12. So you have to exactly know their track like this. Suppose you have a patient of trigeminal neuralgia and it is secondary to your first molar tooth extraction. Is it possible? So one of the branches of the trigeminal neuralgia is the bed is in the first molar teeth. So when you extract that tooth, sometimes it teases that nerve. So you get pain on the whole face. You can't touch your face. So trigeminal neuralgia secondary to tooth extraction, that is first molar. It's a big issue. So you have to inject bottom toxin with a trigger so that the pain is gone. So we treat that also as well. Myofascial pain. You may have patients of myofascial pain. TMJ joint dystonic pain. All these patients can be treated with bottom toxin. So bottom toxin and fillers. There are hyaluronic acid fillers which are used for static lines. For dynamic lines, you use bottom toxin. So these are the areas with aging. If you see, the under eye is known as tear trough. So we correct that with the fillers. Nasolabial folds we correct with the fillers. These are marinate lines. We cover with the fillers. If you see the pre-jaw sulcus, we cover with the fillers. And if you see the neck lines, we cover with the fillers. With the toxin, you see crow's feet, glabular frown lines, forehead lines, platysmal bands. See this? You get not more than 5 to 7 units per band. One. Don't go below.
Vertically also?
Yeah, vertically. But inject horizontally. Don't inject like this. Yes. And don't go below the cricoid cartilage. Because the trachea is very superficial. You might get dysphagia. So don't touch. I got a call from a patient who got injected a lot of platysmal lines below the cricoid cartilage. And now she's breathless. So we give her the Budicort spray. Then we give her inhaler. Then we give her a BiPAP machine for 2 days. So don't do that. Let us not understand that underdosing is a good idea. Doing too much might spoil the cake. So this is what I was talking about. What is the dose you are going to inject? If I say 444, that is for this one, the strongest one. But if it is very mild, it can be 222, it can be 321, it can be 322, it can be 421, it can be 433. And
The
then
minimum dosage?
111.
3 units. Okay.
Yeah, 111. Just for mild line, if you want to rejuvenate the skin.
Okay.
111.
So what about double chin?
So double chin, I do first a filler in the chin. So, and I make a jawline. So it's completely hidden. Then I do the hypho or althea, that is the ultrasound machine, for tightening of lower neck, complete lower neck. So it is sorted, you get a L jawline.
But suppose if the patient like indication is only to remove this part.
Remove.
Not remove, just
Tighten it with the ultrasound, no filler, no toxin.
okay.
HIFU
Ultrasound.
machine.
HIFU hai, there are HIFU is cheaper. Do it with the HIFU. You have the machine?
Not yet.
So HIFU, I have a HIFU also, I have Althera also. They are the best machine. Collagen immediate tightening. So the technology of ultrasound is, suppose you have water in a glass, a full glass of water. Once it becomes ice, will it remain the whole glass? How much does it become? Half? Not half, but 2/3. So once it is water, it is a full glass. When it becomes ice, how much does it become? How much compactness do you find in the ice with respect to water? That is ultrasound. It makes your face water to ice. So you see a 30 to 40 difference in the chiseling of your face. That is HIFU and Althera. Plus it forms new collagen also. So after some time, after chiseling, it starts lifting also. After 3 months. So that concept is very safe. Now US FDA has given it as an OTC product. So you all can use it left and right. Because it is now OTC worldwide. Whether it's Althera or whether it's HIFU, this is your first machine in your clinic, which is your money churner. If you do 30 patients of HIFU in a month, your billing is 10 lakhs. Billing with the cartridge cost. But if you do 30 patients of Althera in a month, your billing is 45 lakhs. And where your cost is 30, you will earn 15 lakhs a month with one machine. It's not only for you. Suppose you buy the machine. You buy for all of them. And it's a portable machine. One day her clinic, one day her clinic, one day her, one day her, one day her. So what happens, you allow others to also earn. Plus they pay you rent and the cost of the cartridge for that one day. So one day a month they will collect their patient before. She'll do that. Anyone can buy the machine and all can use it. This one is in US. When I'm in Orlando, my clinic is in Orlando. Affordable clinic. Those who don't have insurance, they come there. I go once in a year for 2 months. So it's known as affordable clinic. There they come. If you see that clinic, there are 20 doctors who have bought the clinic with $100,000 each. A $2 million big clinic. huge 10,000, and they do rotation practice. So
Be very earned from the same.
no, but if you are working together, your business will increase. Don't get insecure with your colleague. In Bombay, there is a cloth market, Kalbadari. You heard about Kalbadari cloth market? They are illiterate and there are 400 shops together of the same business. It is better to be illiterate, at least you are together. The more you read, no, the more difficult for you to work with somebody. So, at least illiterate people understand why we cannot understand. That if suppose you are good at hypo, you are good at injectable, what she can do? When she does the injectable, she can send the patient to his wife. You should collaborate. Your colleague should be your strength, not your competition. Because there are so many patients, why you have to worry? If suppose you got 4 patients today, next month you get 8. But there should not be any conflict of interest. That's the whole idea. Otherwise, doctors that's why don't grow. Because they have a conflict of interest. That is, why? Today I can teach you anything. You come to my center in Mumbai, I have a training institute. If Ankur and CP takes care of your travel and everything, you can come and get trained in my technique for any machine. Let it be Altera, HIFU, Mirapil, Hydrafacial, IPL, Morpheus. You have heard of Morpheus in mode for acne scars?
Yes.
Superb. It is better than there's one Hollywood Spectra you heard?
Yes.
That is a Pico. It is better.
Pico.
It is better than the Pico and the Q switch. Nothing is wrong. The acne scars are gone. The birthmarks are gone.
Which machine you told?
Hollywood Spectra.
Hollywood Spectra.
I think the distributor is your
Yeah.
leader.
Ishanu.
Bharat. Leader. Yes. I bought it for 60 lakhs. But I went to Korea for training to the company. I went there for 2 days for training. So the idea behind this is, if I have learned everything, if you want to learn anything, just call me, make a WhatsApp group today with me. Whoever wants anything can come to Bombay. The company will take care of everything. Come, learn, go back and start your business. If you don't want to buy, you can rent out the machine 1 day a week. Why you have to buy? If you are buying Hollywood Spectra, you are buying Altera, you 10-20 people, you should inform other doctors, make a group. Whoever wants it, you can send it there. Your cost comes out, you also earn. You should have a collaborative practice. Out of 10, only 1 person should buy the machine. Otherwise, what happens? I've seen one doctor like what's her? Kiran Lohia. Kiran Lohia is a doctor. Chiranjeev Chabra.
Yes.
So she is buying the machine and doing nothing about it. पड़ा है उधर ही. She is earning from injectable, but वो machine एक साल से चली नहीं है. Why don't you rent it out with your staff? Let your staff go, help the doctor there, get the procedure done, you earn some money out of that, get your machine back. What is wrong in that? I don't understand why these people are so insecure over their families. That is why they saturate, they don't grow. So why there is dynamic line and static line? If you see any line in the face, if without expression they remain, they are static. Try to do the botulinum toxin, but avoid doing too much dose. You can repeat next month also, because static line will not go like this. But if the patient can afford the filler, try the filler, the topic is over. But if they cannot afford the filler, if they want to pay 5,000-6,000, then you can do the toxin. Because filler will be 20,000-30,000. We charge 30,000 plus GST per ml. So that is too costly for us. So static wrinkles. So this is the classification for you to inject how much dose. So mild is low dose and severe is high dose.
Click करो सही.
हाँ करो. ये भी कर लो. I'll tell you what this is. I'll spoke to you. 15 degrees intradermal. That's it. Very superficial. You lift the skin and inject. Lift the skin and inject. I'll show you. That I'll show you.
For every muscle we have 15 degrees.
No, if masseter is deep.
Like in process we go 90 degrees.
No, you go 45. Who told you 90? 90 you hit a blood vessel. All the blood vessels are here. It will bleed. It will not bleed in 45, it will not bleed in 30, it will bleed in 90. So you have to decide whether the lines are mild, moderate, severe or very severe. For fillers, the beauty is 1.618. What is 1.618?
Smile.
The Taj Mahal,
Yeah.
the Porsche, the Mona Lisa, everything is 1.618.
Ratios, yes.
Golden ratio.
Golden.
Golden.
No, this is 1 by 3, 1 by 3, 1 by 3. So this is after 1 by 3, this is 1 by 3, 2 by 3. This is 1 by 3, 1 by 3. This will become 1 by 2, 1 by 2. So 1 by 3 is also divided into 2 parts. But this 1 by 3 is divided into 3 parts. This is 1 by 3, but inside also there is 1 by 3, 1 by 3, 1 by 3. And when I see the middle part, that is 1 by 3. So if I have to divide this in 2 parts, it will be 1 by 2, 1 by 2. Am I correct? So this is the golden ratio. And this is just the basics. I didn't go more deep into geometry about the angle. This is 115. This has to be 95. This has to be 95. This has to be 115. That is all that is golden ratio. This is 135. This angle from here to here has to be 135. So you have that vernier caliper. So if you want to be an expert, you should know everything. You should attend cadavers on the face. You should inject in dead bodies. Companies will send you there. You have to show interest to the company to learn. Company will never tell you, we do everything but will not tell you. Because I am not sure how much business you are going to do. Tell me, forget business. First tell me what you want to learn. First step is you learn. Second step is I ask the sales to give you visibility, like some posters or banners, and he'll give you some patient education leaflets, help you with some business and footfall. Or you create an event over here, he'll be here for you that day. So you increase your business. When you increase your business, you increase your sale of my company. Then I tell you, okay, I have a SODC program in Amritsar for hospital. Why don't you go and learn hands-on over there? Because you are supporting us.
Yes.
Then I tell you, okay, I'll send you Singapore. I'll send you to AMWC Monaco. That's the best in the world. For that, there are doctors we have who give a business of 2 to 5 lakhs a month. We send them to Monaco. Then we send you to IMCAS Paris as a delegate from our side. So you get credit points and everything. Bombay, Cosderma, that is CDSI. You send you to CDSI. Go and meet more people in your field. See what is their technical injection. See what is your technical injection. Learn more. Keep reading. The more you learn, the more you grow. So if you want the company to sponsor you completely, then start creating awareness with the help of the company. And go to the right places. You should go to the salons. You should have time with all the matrimonials, because my major business is bridal business. So, because when somebody comes to you for marriage, they come 3 months prior. Only she will not come. उसके डैडी आएंगे, उसकी मम्मी आएगी, उसकी बहन आएगी, उसका भाई आएगा, लड़की के साइड से उसकी फैमिली आएगी. They will give you a whole group package of 10 people or 5 lakhs till marriage. So then after marriage also they come back to you for maintenance for life, half of it. So you should tie up with everybody. In fact, events, if you see bridal events here in Marriott or Ashoka and everywhere, take a stall of 10-20,000. Explain to them what you're doing in your clinic, and there will be at least 500,000 people coming in at event in your area. And they will slowly land up in your clinic. So you have to keep moving. You cannot say, okay, you are practicing here and you will not go to Connaught Place. You can have an event in Connaught Place in Starbucks. You can have an event in any club. If you have a club like Bombay, we have Waters Club, Khana, then Wellington Club, any club. On a Sunday evening, there's a women's day, there's a women's housey, or there's a women's kitty party. You must be knowing which other kitty party is going on. You can, in fact, be a part of the kitty party and put your banners there only. And you can sponsor their meal probably of 10-20,000. So you have to understand that they will surely come up with you. We should tie with FICCI. FICCI is an organization who has influencers. Now that's a little costly, but if you try with Fiki, you are done. Because I am a trainer at ISAC. You know ISAC, I am in charge of ISAC, Han Market, Vasantya, and Bombay. Bombay is next to my house. She opened for me only. Now she's opened Bangalore and Pune also. So they do all these Fiki tabs, influencers, Meg Oberoi, Archana Raghia. They are all our influencers, Neetu Singh, Malaika Arora. They all come to our clinics. So why do they come? How you do it? Don't pay them. Tell them I have these machines. You pick up 1 year service free from me. But I have these 2 press conferences, you have to be there. So male-female ratio for the fillers. So this is what I was talking about. This is Apple is same 1.618. This is a golden ratio. Porsche, Italian, they are all on the same formula. How you make the face. So this I was talking about. When you treat a face, you have to take it this way. Actually, people don't know even aesthetic is science. They're natural. God has given you this. When you inject botulinum toxin, they become ulta. So, apart from removing the lines, the function of this will be the red will become blue and blue will become red. So just think when it becomes that, what is going to happen? No, you should underdose. You should take low dose. And the dose should be so low that the line should go away, but expression, the line's color should not change. You cannot inject too much. Because if you inject in the forehead and if it freezes, patient will not come back to you. We will do the maximum treatment.
Maximum.
This time you will not have a problem.
Sir, maximum we can inject 10 units.
Where?
For frontalis, 4 units. This is the maximum dose.
They say 20. You inject 10.
Then we have to start with 10.
I told you about the indications that you are following. This is the forehead line. So I will show you the injection sites now. This is for the forehead lines. This is your globular frown lines, process and corrugator, 4 units each. This is how you inject. If you want to take a picture, when you are injecting, you should have this picture in front of you. How much do you charge per unit here for the patient?
350, 450, 400.
500, no minimum.
450.
I charge anything between 500 and 1000. 500 से कम में you waste a lot of units also, right? This is the crow's feet injection, 3 shots, 4, 4, 4. So this is a 900 kilodalton I told you. This is the 150 kilodalton complex of heavy and the light chain, and this is a 750 kilodalton. So whole molecule is 900 kilodalton. Okay. So coming back, what does it do? It reduces the release of acetylcholine, which inhibits the contraction of the muscle. So the wrinkle temporarily vanishes. So this is the before and after for the malar rejuvenation, that is mid-face. Slight lifting with the filler. Filler. This is with the filler and rejuvenation. This is with the bottom toxin Stunnox. So what you do, you inject on the hairline here till the tragus of the ear, 2 rows. And in 15 days you see this lift. You see this difference? Because those who don't have a big budget and have a budget of only 50 units, they can't afford a filler or a Altera of 1.5 lakhs. But still you can get this difference. I will show you how it looks in the female. See this bottom toxin. You see this face and this face. What I did, I gave a lift over here. Plus I did a masseter. Only bottom toxin.
How many units?
1 unit each side, 10 up to the tragus. Again second row of 1 10 20. There is 40.
40.
After that 10 here is the masseter. So 60. After 15 days this is what you get. You can do it for her and for her. You can do masseter for her also and her also. She's from Delhi. This is the Altera. You see that neck?
Neck.
I'll show you the neck. See, this is the Altera. This is also the Altera. This is the face. So, there are a lot of things I could show you, but I thought we cut it short. And we will go more for hands-on and we will do some training. How to dilute the wine, how to take it in the syringe, what to talk to the patient, how to counsel with them, how much to inject, what should be the price accordingly. Let me tell you, area-wise you put the price. If somebody wants a masseter, no, that's going to be too costly. Because that's going to change the road face. Somebody wants a crow's feet, they may say, okay, don't do it, I will say I'll camouflage. But when it comes to masseter or glabular frown lines here, they'll pay you anything. Sometimes girls like the forehead, like they say, no, don't touch my forehead, I'm okay with it. But they will never allow these glabular frown lines. So what do you tell a patient when you want to see the lines? What is the expression you want?
Like angry face.
एकदम जोर से स्माइल करो, फुल स्माइल.
Full.
You see the crow's feet. You गुस्सा करो, angry face,
Angry face.
and raise your eyebrow. And दांत चबाओ, chew, masseter. Raise your eyebrow and touch the occiput. See, if your eyebrows are too high, inject 5 minutes, the eyebrows will come down. I am telling you. The other thing is, if you see a fold on the eyelid and wrinkles, we can remove that also. You inject 3 minutes here, everything is gone. I will show you where.
So
to
which
do.
wrinkles you are talking about?
Eyelid.
Eyelid.
Not eyebrow, inside the eyelid.
Eyelids.
There is a fold
Yes,
and
yes.
wrinkles, so we remove that also.
By injecting here.
I will show you.
Within 50s and 50s.
I will show you everything. The best part is I have around 10 advanced courses. So this is the first basic course learning. Next time I will tell you how to inject stunnoxbotox toxin in the biceps. I can reduce the muscle. Those who gym a lot. The trapezius. Your shrunken shoulder for wearing a low dress. Then we can do the adductors for the jeans that you wear. Gastrosoleus for the skirt that you wear. So that is a very costly affair. So we inject 400 in the patient. They should have 1.5 2 lakhs for one procedure. They have to come thrice a year. This is only for rich people. So with that, use the Exilus 360, the M-Sculpt Neo that I have, and Exilus 360. So it reduces fat by 20%. Muscle it doesn't touch, it builds muscle. So what we do first, we waste muscle. Suppose you are tummy, so we do Exilus 360 in a tummy. It reduces your waist by 3 to 4 inches in 4 sessions. That's USFD approved. Then it also gives you muscle building. So if you are very, very genuine and disciplined, you will get a 6-pack.
It's of the same principle that pool fees, pool sculpting.
This is heating. Exilus is different from pool sculpt. Exilus is BTL, it is far superior to pool sculpt. Pool sculpt forms complicated bulges. It's not good. So then we start with the procedure. चले?